Okay, welcome back to Post-COVID Recovery Guide. We are on lesson 2 of module 1, What is Post-COVID? Let's dig in. So, risk factors for post-COVID that are significantly associated with higher risk of developing the post-COVID condition include being female, being an ethnic minority. Now, we don't know if that's yet biological or if it's due to the disparity in the healthcare system. Socioeconomic deprivation, smoking, obesity, and comorbidities. So comorbidities are diseases or conditions that are present at the time of infection. The ones that are associated with a significantly increased risk of post-COVID include COPD or chronic obstructive pulmonary disease, asthma, congestive heart failure, prior heart attack, stroke, chronic kidney disease, and diabetes. Since post-COVID is a fairly new area of study within the medical field, there's currently no concrete evidence pinpointing towards a clear cause of the condition. We do understand that it is unsurprising to have long-term symptoms after being hospitalized for a serious life-threatening illness. However, studies show that individuals who experienced only mild to moderate symptoms are most likely to have post-COVID compared to those who were affected by severe COVID-19, requiring hospitalization or intensive care. There are a number of emerging theories that are currently being studied in the hopes of developing treatments to target the underlying biological mechanisms, particularly in those who've only had mild to moderate COVID-19. The first is autoimmunity. So autoimmunity is essentially when the body's immune system is turned on, but then turned on towards itself. So it sees itself as a foreign invader and inappropriately the body attacks itself. So in a study published in September of 2022, patients with long haul COVID-19 were compared to those who were not long haulers. So researchers took blood samples from 100 long haulers at 3, 6, and 12 months and compared it to people who did not have post-COVID, again at 3, 6, and 12 months. The 41%, so 41% of those long haulers actually had markers in their blood that suggested autoimmunity. So that is certainly a big factor. In addition to that, some people who develop a post-COVID will go on to develop new autoimmune conditions such as rheumatoid arthritis or irritable bowel disease. The second is viral persistence. So post-COVID's neurological symptoms can be caused by the coronavirus itself. Although it's not clearly understood, there have been reports of autonomic nervous system dysfunction. So the autonomic nervous system is part of our nervous system that controls involuntary processes, such as breathing for the most part, unless you choose to override that, heart rate, blood pressure, and such. So those have been abnormal for some individuals, such as an increased heart rate, which is quite common, with very little physical effort. This is also consistent with other viral illnesses which are not COVID-19. So the third theory is persistent inflammation. So post-COVID symptoms may be caused by lingering mild ongoing inflammation following the recovery of the virus, of the acute phase of COVID-19. So as I discussed about the viral persistence, there still may be these undetected viral particles hidden within the body's tissues after the infection. This is what is theorized to cause this chronic inflammation. So the virus can hide itself using different proteins, undetected by the body's immune system, but then cause this ongoing inflammation. And this is where a lot of symptoms can come from, particularly neurological symptoms. And the fourth and final theory for now of post-COVID is microclots. So post-COVID may be a phenomenon of multi-organ damage, meaning that, many systems within the body can be affected. So MRI studies have shown that there are various abnormalities present in different organs of the body following COVID-19 infection. And some studies have shown the presence of these microclots, these very, very tiny clots in the microvascular system. So the hypothesis for the cause of the multi-organ damage is due to chronic mild inflammation caused by the COVID-19 infection and or small blood clot formation within the blood vessels supplying the organs. So if there's blood clots there, the organ is not getting sufficient blood supply, causing that damage over time. That concludes lesson 2. I'll see you over in lesson 3.